everybody to the July 7th morning Board of Commissioners meeting. I'm going to read in just a few words here that we do every morning. We are in our virtual format still, so we have some housekeeping items to review. To the public watching the meeting, when you registered to watch the meeting, you're registered in our system as attendees. Attendees are webinar participants and simply viewers of the meeting, an audience member. Your microphone and your webcam are automatically muted, and there will be time though at public comment for you to be able to raise your virtual hand. And when that time comes, the moderator will take over and will ask you to raise your virtual hand. You'll see a hand icon device on your computer. Simply press it once to raise your hand. When public comment begins, the organizer will call your names. And when your name is called, you'll be given 3 minutes to speak and she will unmute you. When your 3 minutes is up, you'll go back into muted status and she'll call the next name, and you're welcome to stay on and watch as long as you'd like. We try to give everybody who wishes to present public comment an opportunity to speak. But please note, if there are more people wishing to speak than we have time, we might need to limit the amount of speakers or have a reduced amount of time per speaker, or be able to randomly select speakers. We haven't had that problem yet, and hopefully we will continue to be able to hear everybody. Speakers will then, when public comment is over, everybody will go into muted status. So thank you for being with us. We'll go to our first item, which is an adjustments to the agenda. And I have that Commissioner Farr is interested in pulling B1. So we'll pull B1 and talk about that after we do consent calendar. Any other adjustments to the agenda? Seeing none, hearing none, we'll go to emergency business. We do have one item for emergency business, order 20-0707-15, -07-07-15, just to be clear. In the matter of selecting a Lane County Commissioner to represent the entire Board of Commissioners for the purpose of voting in the 2020 National Associations of County Virtual Annual Business Meetings. And we have with us Alex Kyler. If he's not here, I can say a little bit about this.
And I'm happy to share some, Chair, but I know you were partly the impetus for this, so
I was. I can start, and if I miss something,
Sure.
Go ahead and add in. So I was looking at the virtual meeting for NACO, and they sent an email mentioning that we didn't have some information they needed in order to vote at the next virtual meeting. And one of them was a designee from our group in order to do any voting at the virtual meeting. I was planning on attending, and it's in a week or two. And if we want to participate, and I think it would be a good idea for one of us to be a designee. It's a requirement in order to vote at their virtual meeting. And I think it'd be great to have a voting member there. I'm happy to do it, but I'm also very open to having anybody else who's wishing to do this so they can participate as well. Commissioner Sorensen.
Are there any other commissioners besides you that want to be the designee? And you can raise your hand. If not, I'll make a motion. So at this time, I'll make a motion. We appoint.
Oh, we got one hand up. Commissioner.
Yeah, okay, Commissioner Farr.
Just for the record, I would like to be, but I certainly acquiesce to the chair being. I think it's appropriate.
I'm just fine with having Commissioner Farr do that also. Mr. Mccroskey, did I miss anything else in the description?
There are just a couple of items to be voted on at the conference. One is the second vice president, and the other is sort of some bylaw update changes.
Commissioner Burney.
So is this simply to vote and then there will be no residual responsibilities or statuses or whatever attendant thereto? Is this simply for the vote at that specific conference?
That's my understanding.
Okay.
I've never gone to a conference like this, so you know, the other commissioners may have more experience on how this works.
Commissioner Buck, it's Alex Kyler.
Thank you, Alex.
Hi. Just to give you a little bit more flavor for that, Commissioner Burney, this is the first time they've done this way because of the COVID-19 pandemic, and really, this is not. I think this is just a business meeting that they call the business meeting where the elections for officers and any bylaw changes occur. The other thing that I think the board ought to know is that what you're doing is giving your designee 5 votes. So you're really sort of giving responsibility of the entire board to the one person.
Thank you. Commissioner Sorensen.
If more than one commissioner goes, can we divide our votes so that we can have 2.5 to Commissioner Farr and 2.5 to Commissioner Buck?
This is Alex again, Chair Buck and Commissioner Sorensen. I did look at the FAQs yesterday from NACO, and I don't believe that is possible. I believe that it's sort of an all or nothing designation. We could probably find that out irrespective of how this board order goes, whether that's an acceptable way to go.
Well, I'm not planning to attend the meeting myself, but I have attended these meetings before, and my recollection is that it's been all the votes that a particular county is afforded goes to one representative from that county. But I think that's mainly because only one commissioner would be attending the business meeting each year.
Well, it's virtual this year, so all of us can attend.
Yeah.
Commissioner Farr.
Thank you, Chair Buck. I believe that Chair Buck has been a superb representative of the entire board for the last several months, with a much heavier load than typically the board chair would have. And I would certainly trust and actually be proud of Chair Buck representing Lane County.
I appreciate that. I'm sure you would be.
I'll move that we appoint Commissioner Buck as the board representative and approve the order as presented.
Second.
Okay, moved by Commissioner Sorensen, second by Commissioner Bozovich. Any further discussion? Hearing none, we'll go to a vote. All those in favor, please say aye.
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 All those opposed, say nay. Motion passes unanimously. All right, we'll move on to public comments, and I'll transfer it over to the moderator.
Thank you, Chair Buck. At this time, I believe I have 2 people in the queue for public comment, or at least I have 2 people who have joined. If you would like to give public comment, please raise your virtual hand and I will call upon you. When I call upon you, I will unmute your microphone and then I will start your timer. When you see the timer begin, you may begin your public comment. At this time, I would like to call upon Richard Self for public comment. I will unmute you and I will start the timer. 1 moment.
If I'm being able to be heard.
We can hear you. Let me start the timer and we'll start and you'll start. Sorry, I'm getting a lag on my computer. Sorry. 1 moment. You may begin your public comment.
Yes, thank you, commissioners. Thank you, Chair Buck. I am coming to you because there is no remedy yet for any of the situation with the unhoused community. And since the closure of the respite shelters, in fact, the hand washing stations that were out there and about, many of them have been taken away. As per the governor's conference with the Dr. Seidlinger of the Oregon Health Authority and so forth, it did not sound in any way, shape, or form that this pandemic, this crisis is near over, near better, and yet the citations, the ticketing, the sweeps, as just demonstrated this week in Washington Jefferson Park and elsewhere, are continuing on as if nothing is ever changed. Yet we say we learned a lot. We learned a lot. That's all I heard during the pandemic. Boy, we learned a lot. We learned a lot. Well, what did you learn? How to kick people around again and do all this. There needs to, when we're thinking about police reform, we should start with Lori Haber's report from the Law Center. That's a very small steps in decriminalizing homelessness and decriminalizing people for just sleeping where they're at. Rather than doing all of this all over again, I thought we learned a lot. I notice in the agenda today also the sheriff's work crew will come up as one of the agenda items, and whatever you guys are thinking about the sheriff's work crew, they're one of the real, I hate to say it because there's no, I don't want to beat up on a department, but the sheriff's work crew is one of the villains of this. They go out there and just confiscate everybody's things while nobody's there on a 3-month backlog or what have you. If we're talking about equality for all, we need to include those who are unhoused in this equation. I have more to say, but I'm going to let it go at that. I yield my time. Thank you.
Thank you for your public comment. I do see Diane Schaefer has registered for the meeting, but I do not see your hand up. Ms. Schaefer, if you would like to give public comment, I'm going to unmute you. Now I see you. One moment. Let me unmute you. And when you see the timer reset and begin, I will, your public comment will begin. One moment. You may begin your public comment.
I simply wish to agree with the previous speaker. I speak in support of his points and agree with all of them. I yield the balance of my time. Thank you.
Thank you for your public comment. Chair Buck, at this time, that is all the people who have signed up for public comment, so I will return the meeting to you.
Okay, we'll move on to Commissioner's response and remonstrance. Anybody like to speak? Commissioner Farr.
Thank you, Chair Buck. Mr. Self-Rich, it's always good to hear your voice. Since the day that I met you at the Mayflower Theater that evening, watching the movie. Rich, I'd invite you to the Shelter and Stakeholder Subcommittee of the Poverty and Homelessness Board, which meets next Monday at 2 o'clock. A part of the agenda that day will be discussing exactly what you raised today, the reduction in shelter based upon, for instance, the closures of the emergency shelters, the temporary emergency shelters, and the distancing that's taking place in the other shelters, such as the Dusk to Dawn program, which has reduced its occupancy by around 50%. We're experiencing that, and it has become a pretty critical issue. That agenda on Monday will include a full discussion of where we are on winter strategies and what our goals are for what we're now calling inclement weather strategies, as opposed to winter strategies. I hope that you're there virtually, Rich. You always have good things to say, and you'll be welcome at that meeting. Thank you.
Commissioner Sorensen.
Thank you so much. I just wanted to comment on a couple of things this morning. The first is the big picture of our cases, our COVID-19 cases. when we went from phase 1 to phase 2, we did that because we saw a reduction in cases. And what we've seen in the last 3 weeks is a rapid increase in the number of cases, yet we've seen no recommendation from public health to roll back our recommendation to the governor to from phase 2 to phase 1. And I really think that the public concern is out there and the medical evidence is out there that would justify going back to phase 1 rather than let the global pandemic that's hitting us continue to expand the number of cases. Well, it's good news that we only have 3 people dead, and we have none in a hospital that I'm aware of. That's all good news. Relative to other places, it still doesn't change the fact that we've had a significant increase in the number of cases. And there's certain groups, particularly young people, that apparently are paying no attention whatsoever to this global pandemic. And that's why we're seeing, particularly among young people, the explosion. I know in my own experience, since we've gone from phase 1 to phase 2, I felt a little bit better about going out, and I've noticed radical differences between different types of businesses. And those were things I didn't know for 3 months because I was pretty much locked down myself and I hadn't gone out of my house much, certainly not into any store. So I just want to register a concern that our public health staff is not recommending going back to more controls, more restrictions, and we have no local ordinances to enforce because of the view that we should only have whatever the state is willing to give us, and we have no enforceable local rules. And last but not least, I'll just touch on the point made by the commenter this morning, and that is that the shelters were set up because of the concern that the homeless would be congregating without a proper controls and would be spreading the disease. And yet, when we went from phase 1 to phase 2, somehow there was a recognition, maybe we don't need this anymore. And so they began to cut back on this. Meanwhile, there's been an expansion in cases. I don't understand this dilemma. To me, it's a dilemma. Why would you cut back on the services to homeless people if the reason you installed those temporary services was because of the COVID global pandemic hitting our community? So those are a couple of concerns I have, and I hope that staff, when we get to that point in the agenda, will address these concerns. Thank you.
Any other response or remonstrance? Okay, seeing none, we'll move on to the consent calendar. I would entertain a motion to approve the consent calendar with the exception of item B1.
I move approval.
Second.
Okay, moved by Commissioner Sorensen, second by Commissioner Burney. Any discussion? Seeing and hearing none, we'll go to the vote. All those in favor, please say aye.
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 All those opposed say nay. Motion passes unanimously. So we'll go to item B1, which is order 20-07-07-01 in the matter of awarding 2 contracts to Looking Glass Community Services for Youth Services and delegating authority to the county administrator to sign these contracts. Commissioner Farr, would you like to speak to that?
Thank you, Chair Buck, and I will be brief. I'm just taking this opportunity to call out the work of Looking Glass. These are 2 of the projects that Looking Glass works on. They have a lot of capital projects, including schools, or youth residences, et cetera, throughout the county, and they've been working in our community for many, many years. These 2 projects are particularly important in that the first is the youth transitional housing, which Looking Glass administers annually, and they've done a superb job. And with that one, I'd like to point out that Mr. Mccroskey and I have been well, Mr. Mcroskey and I've been watching. You know, my job is to watch. Mr. Mcroskey's job is to work. Looking at a youth crisis center. And that youth crisis center is going to, at the current time, Looking Glass and representatives from 12th Night are looking at consolidating services to provide what really will be our first youth crisis center. We're a little bit closer than we thought we might be. I'm not going to go into too many details about that right now, but I'd like to thank Looking Glass and their board and the work that they do in helping move this project forward. And Mr. Mcroskey, thank you and your staff for looking extemporaneously at new ideas regarding the Youth Crisis Center. The second is the award for the, I'm going to pull it up really quickly here, for the Mckenzie Rapid Rehousing. Now that is an award that's from the COC, the Continuum of Care Award that comes through HUD annually. Lane County's Poverty and Homelessness Board administers the Continuum of Care grant and makes the recommendations to whom that is going to be awarded. This is one of the recommendations that came through the Poverty and Homelessness Board, through the Human Services Commission, and for approval by the Board of County Commissioners. Mckenzie Rapid Rehousing has been very effective, and I'm just going to give you a very brief story of one family. Last Christmas, Jeff and Tandy, I'm not going to give their last name, and their two children spent their holidays in a tent. It was Jeff and Tandy's second Christmas in a tent, but in Jeff's words, much nicer than the previous year because there wasn't an ice storm. The Chapmans became homeless in October 2016, and after 2 years of experiencing homelessness, the family finally got the call they were waiting for. A spot had been opened in Shelter Care's Mckenzie Rapid Rehousing. It takes families who are living in tents, and puts them into permanent supported housing. And that's the kind of work that Looking Glass does in our community, has been doing, and coordinates their efforts with multiple other nonprofit agencies and governments in our community. So I just wanted to call that out, Chair Buck, and with that, I'd like to move passage of item 1B. I'll read it, excuse me.
B1.
B1, thank you.
And it's,
In the matter of awarding 2 contracts to Looking Glass Community Services for youth services and delegating authority to the county administrator to sign the contracts. That was a motion.
Second.
perfect.
Thank you.
Moved by Commissioner Farr, second by Commissioner Bozovich. Any further discussion? Seeing and hearing none, we'll call for the vote. All those in favor, please say aye.
Aye.
All those opposed, say nay. Motion passes unanimously. All right, we're moving along pretty well this morning. We'll move to item 6A. Oh, yes, I got everything. Okay. 6A, which is Order 20-07-07-10 in the matter of awarding 5 COVID rent relief contracts and delegating authority to the county administrator to sign the contracts. And with us is Karen Gaffney, our Director of H&HS.
Morning, Chair Buck and Commissioners. These 2 items, A and B, are actually companion items. The only difference is the second one is the contract to St. Vincent de Paul. So on item A, we're asking to award 5 contracts to our nonprofit partners to help with the distribution of the COVID rental relief assistance that is flowing to the county. I know the board has been tracking on that closely as those relief dollars have moved to us. And these contracts will enable us to then process applications from the community and help get those federal dollars out into the hands of people who need it for rental relief. So these are the contractors who would be our partners in distributing those funds.
Thank you. Any questions? Yeah, Commissioner Bozovich.
Thank you. So the board packet talks about the delegated authorities and new amounts, but it doesn't have reference to the old amounts. Can you tell me what the total increase in rent relief is with these 5 contracts?
Oh, Commissioner Bozovich, off the top of my head, I could not. I'm so sorry. Is this one of those where you've already done the work and you know the answer, or should I get back to you with an email?
Get back to me with an email. I have not done the math because I'd have to look up each individual contract, which aren't available to me easily online.
Okay, and I apologize, I don't have that data at my fingertips, but I will get you that amount today. And in fact, we may even have an answer by the time Steve Manila is in front of you later this morning on the rental relief item.
Thank you.
Commissioner Burney.
First, I want to congratulate Commissioner Bozovich stumping Karen. That rarely occurs in these meetings. Karen, does this relate to the additional 930 some thousand dollars? Because I added the numbers and they add up to more than that. So is that built into these contracts or no?
So these contracts are specifically for moving, you might recall that second amount of money that are federal dollars that are coming through us. The first amount was state general fund dollars that came to the county. And this is that second set of dollar amounts. And so that's why it adds to more than that.
And I recall there was some discussion at the time about the county using existing nonprofit partners as infrastructure to get resource out. It looks to me like this reflects that discussion. Am I correct?
Yes, and actually we are looking to use a combination of kind of an all hands on deck approach to getting these out. So yes, we will use these nonprofit providers, and we also will probably do some of this work internally. And I know we've been talking with Homes for Good and other partners in the community to help us move these dollars out.
And when we look at these dollars, is there admin built in, or is this 100% going to rent relief for needy Lane County residents?
Thank you, Chair Buck and Commissioner Burney. There is funds that are required in order to administer these services. So I want to be transparent about that there are some direct charges to administer that. There is not an indirect that's built into this. So, you know, some grants might have the ability to take an admin rate off the top, and that does not occur with these dollars. But where there are specific staff costs that are direct charges in order to get it out the door, then those are eligible to be charged against the dollars.
So I'm not being critical, but I am going to request that at our next meeting, you provide us the same accounting with the actual dollars that went to rent relief to needy residents, if that would be okay.
Yes, we can do that.
Per
and of
line
course
item, per contract.
What we can provide you, because these will be, it's a rolling number as applications come through and get funded and approved, and then those dollars move through. We do have the dashboard that we're maintaining by contractor of how many applications have been received and processed and when those actual rent dollars go out the door. So I think that's what you're asking for. Would that satisfy you?
I think it, I'm insatiable. No, I'm just kidding. I think, yes, I believe it would, but just to clarify, even if they're rolling numbers, if we could get the total amount encumbered in a real-time basis, if they're rolling, and then of those, the actual dollars that went out to rent relief. As long as that's
yeah, I think that what we have will be able to answer your question. And if when you see that it doesn't, please give me that feedback. My hope is that without taking staff to do a whole lot of additional administrative work, we can use the dashboard that we currently are maintaining and provide you that information and get you what you need.
Okay, my comment is that it requires almost no additional work for each agency to provide what I just requested, like none. And then finally, when are these dollars going to hit? Are you also going to show when these dollars are hitting the street? Because the need was yesterday, and I'm just always fearful, and I've seen it happen, that there is such a lag between the allocation of dollars and when needy people get them. So do you have any sense of that?
Thank you for asking that question, Commissioner Burney. And I'm gonna quickly, I posed that question to our staff yesterday, so I want to pull that up and make sure I'm giving you the accurate information. As you know, the first set of dollars, those state dollars have already been released and are moving out into the community. And What I had asked and what I think you're asking is what's the date when these dollars will become available? And I'm sorry, my Outlook is not working for me right now, so I can't get you that information. But when Steve is in front of you later this morning, I know he'll have that detail for you.
Thank you very much, Karen. Thank you, Chair.
Commissioner Farr.
Thank you, Chair Buck. The officers only allowed 5 minutes for this, so I'm going to keep this very, very short, although the discussion is good. Thank you, Commissioner Burney, for your questions. Last night, I read a thank you message from the Lane County Renters Association. Excuse me, it's called the Eugene Springfield Renters Association. And the thank you, Tenant Association, excuse me, wants to thank for our serious consideration of the 6 policy proposals presented to you. I've not had a chance to dig into the thank you letter we received from the Springfield Eugene Tenant Association yesterday, but do you know off the top of your head, Karen, is that anything to do with the motion that we're considering right now?
Chair Buck, Commissioner Farr, I am going to acknowledge I was trying to track down the answer to Vice Chair Burney's question, and I missed some of your question. Could you repeat that for me, please?
Very quickly, we last night at about 9 o'clock, I read a thank you that came to us from the Springfield Eugene Tenant Association. They want to thank us for our serious consideration of policy proposals presented to us surrounding HB 4213 and surrounding HB 4213. And I was just wondering if the motion that we're considering right now has anything to do with the thanks that they sent yesterday. I've not had much of a chance to research exactly what it is they're thanking us for.
Thank you, Chair Buck and Commissioner Farr. Sorry, I had to ask you to repeat that. I would say yes, and I think that the policy discussion that you have scheduled for later is probably more on point with the thank you note that came through. Certainly, there has been a significant demand for rental assistance, and so the motion before you today is to actually get those dollars out into the community. So I think that's very important. And I am suspecting that the policy work that you have been doing, particularly going into the last special session, was particularly impactful for the Tenant Association in helping to advocate for an extension of the moratorium and some of the other key policy pieces that also help people be able to stay in their homes.
Perfect. Thank you, Karen.
And Chair Buck, if I could just add, I do have an answer to Vice Chair Burney's question from earlier. July 15th is when these funds will open up.
Thank you.
Great. Any other questions? If not, I'll entertain a motion to approve the order as presented.
So moved.
Second.
Okay, moved by Commissioner Burney, second by Commissioner Farr. Any further discussion? Seeing and hearing none, I'll call for the vote. All those in favor, please say aye.
Aye.
All those opposed, say nay. Motion passes unanimously. Thank you. The next one, I am going to hand the proverbial gavel over to Vice Chair Burney. Vice Chair, once you're able to read this in, could you acknowledge me for a recusal on this item?
I will acknowledge you for not being acknowledged. Okay. Acknowledging that the chair has recused herself on this item. The item is order.
No, if you could just read it and then I'll declare.
We're looking at 6B. Correct?
Yes.
6B, order 20-07-07-11, in the matter of awarding 2 COVID rent relief contracts to St. Vincent de Paul and delegating authority to the county administrator to sign the contracts. Chair Buck, did you want to say something at this point?
Thank you very much. Yes, I'm going to recuse myself as a conflict of interest. I am related to the director of St. Vincent de Paul. And because I feel this is an actual conflict of interest, I'll recuse myself by muting myself and turning my camera off. And when you're ready for me, just call my name. Thank you so much.
Thank you. Karen, I believe this is your item.
Thank you. Yes, this, I will not take time today to do additional introduction to this item. It is a companion piece to the earlier award, and again, moving those same dollars out for administration of the rental assistance program, and in this case to St. Vincent de Paul.
Thank you very much. It looks to me like Commissioner Farr has a question.
Another question, just a quick item, and that is regarding Chair Buck's recusal. You know, I want to point out that Chair Buck, the reason the chair is recused is really in no small part because of the many years of work that she has put in, not only with St. Vincent de Paul of Lane County, but with other nonprofits providing housing. She happens to be recused right now because of this particular vendor, this particular nonprofit. But I know we all acknowledge the work that Chair Buck has done through the years, helping provide housing to the people who need it the most.
Is there any further discussion? Do I hear a motion?
I move approval.
Second.
It has been moved by Commissioner Sorensen, seconded by Commissioner Farr to approve this item, which is 6B, Order 20-07-07-11. All those in favor, please signify by saying aye.
Aye.
Aye. Opposed? The ayes have it. The vote is 4-0. Commissioner Buck abstaining. Thank you. Okay. Steve, were you scratching your ear? Or do you want to say something? Okay, gotcha. Chair Buck, the gavel is now yours.
Thank you very much. And thank you, Commissioner Farr, for your kind words. We are a little ahead of time for our 10 a.m. time certain of item 7A. So we're going to just kick off 7B for a little bit. We may have to pause that conversation and move back. But in order to just keep the meeting moving, let's get started. Mr. Mccroskey.
I'll just make a couple of quick comments, introductory comments, and then turn it over to Karen Gaffney. One is to say that starting last week, we, and Karen can talk a little bit more about we have both a emergency response effort to COVID-19 happening led by our public health team and Ms. Gaffney, and we have a recovery effort that has been led by Patience Winningham, our emergency manager, and a team of folks who are focused on economic and housing and shelter recovery efforts. That will continue, although I think, as we've already talked about today, given that we are seeing a rise in the number of cases, we are moving some of our folks who have been focused on recovery into our response efforts. So I'll have a more brief update on recovery. I wanted to just briefly, in teeing up Karen, address a couple of the comments that Commissioner Sorensen mentioned under remonstrance, and call out 4 areas in particular that I'll just speak for myself that I'm monitoring, that I view, and I think our Karen and our public health team, this is all data that they provide, but that we all as a team view as really critical. There's no question that we've seen an increase in the number of cases. It's important to note that we're now reporting cases differently. Karen will talk about presumptive cases and positive cases being combined together, as opposed to previously they were separated out. But we are seeing an increase, and I want to point out the 4 areas that we've really been focused on. 1, testing. We're averaging around 500 tests per day. Our public health team is doing an incredible job of targeted testing within certain populations to make sure that we're identifying where the virus is and where it is spreading, and then doing that contact tracing. Number 2 is monitoring the sporadic case rate. We shared with the board last week, the state of Oregon is monitoring the rate, the number of sporadic cases in counties across Oregon. These are cases that don't have a connection to a household or another known case. The higher your sporadic case rate is, the more concerned public health officials are at the potential for wider spread outbreak in your community. As of last week, Lane County had the second lowest sporadic case rate of the 36 counties in Oregon. So that's an important one for us to continue to monitor. And being the second lowest in the state to date is arguably a reflection of the fact that we have so many individuals as part of these cluster groups. Number 3 is hospitalizations. As of yesterday, and I think today, Karen will update this, we had 0 hospitalizations. So the severity of the virus in our community remains manageable, and we're not overburdening the healthcare system to date. And then the 4th one is the number of infectious cases. So this is another reporting change that's been made at the direction of OHA. And Karen will update on the number of infectious cases, but these are, as opposed to total case numbers that we report going back 3.5 months, infectious cases are those that are actually shedding the virus currently. And that number, while we've seen an increase in the number of total cases, the number of infectious cases has actually dropped slightly. So monitoring those, continue to monitor those 4 areas as we consider making decisions about changes in phases or approaches, or how this response effort and virus is spreading in the community, making sure that we're looking at those 4 areas of testing, sporadic case rate, hospitalizations, and infectious cases, I would argue are really important things for us to focus on, so that we're not just following the data on whether or not cases are increasing, but we're looking more deeply at those specific areas to determine our success in managing that. So with that, I'll turn it over to Karen.
Thank you, Steve. I appreciate all of that, and I'll just tell you now, Chair Buck and Commissioners, some of that you will hear me repeat as I walk through it too. I think it's really important information, and I am just reminded that we really are all on team public health at this point, and I appreciate how much time, attention, and care the board and the county administrator continue to devote toward this important public health issue. So I'm going to walk through with the time that I have now, knowing that Chair Buck, you'll just give me the high sign when you want me to pause. The information that the board has asked to regularly be briefed on, and then I'm happy to answer whatever questions people might have from that. The first, and I know it's been a couple weeks since you've met, so my guess is there may be some questions, and I know many things have changed, so I'm happy to take whatever time you would like on this topic. In terms of our number of cases, which is the first element the board has been tracking on, as the county administrator said, clearly our numbers have been increasing, and I will remind the board and the public who might be listening that all of our local data can be found on our website. If you go to the Lane County website, you'll see a yellow band across all of our pages with a link to our coronavirus information. Click on that, and there's a link for local data, and it's just a nice place for anyone to be able to track those changes. It's regularly updated as more information comes in. So you can see on that site our epi curve, which we've shared with the board over the months of the pandemic, and since the middle of June, our number of cases really have been increasing. And if you look at our numbers as of today, I've been watching my email, and we haven't had the update for the overnights yet. So the numbers I'm going to give you are from last night, and I'm sure those will change this morning. But we had 241 total cases. And I would say that as more time passes, that number becomes less relevant for us, because that's the number of cases for the whole length of the pandemic. So we know that number is always going to go up as we get cases. As the county administrator indicated, the health authority has made a reporting change that I think is important for the board and the public to understand as we move through this. They've changed the definition of recovered. As you know, we used to report our active cases are basically those people who have not yet recovered. And they've changed that definition now to say, instead of having nurses track on whether someone has recovered or not through our phone calls and contact tracing, they've said across the board, they'll determine if someone has been diagnosed with COVID and is still alive 60 days later, they will be considered recovered from COVID. So there's no in between that. And that's a pretty wide definition and doesn't give us the accurate information we need to know as a community about how many people are really currently experiencing the disease and are infectious in our community. So that's why we've created this new category that you'll see on our regular posts, which talks about people who are infectious. And those are individuals who are still likely to be shedding the disease, and those people then whom we're focused on our contact tracing efforts of quarantine and isolation. So that's how we'll talk about our data moving forward. And we also, since you last met, have been combining at the state's instruction a total case number. So it combines people who have a positive test for COVID-19, as well as those who are presumptively positive, which means that they have symptoms and have had an extended exposure to someone who has tested positive. So those two numbers are combined for a total case. So I did just get an email from our public health staff that says, as of this morning, we have 243 total cases. And of those, one person is hospitalized. And we have 63 people who would be considered infectious right now. So that's the current state of cases in our community. And I want to underscore the answer to Commissioner Sorensen's question about how will we know when public health will recommend revising our movement in phase 2 and looking at possibly locking things down in particular sectors or countywide. And there are two sets of data that we look to as we study that. The first was covered in Dr. Ludke's initial blueprint. At the very end, he talked about what are the triggers that we'll be monitoring to be able to know if we need to take future action. And so those three triggers were about significant increases in cases that are not epidemiologically linked. So that's what the county administrator talked about, sporadic cases, which are those who are not epidemiologically linked. We also look at the number of people hospitalized because that's an indicator for us of serious disease. And then finally, we look for significant outbreaks in individual communities or specific settings that might necessitate targeted action. So those three things then are coupled with the state dashboard, and that is a weekly dashboard that OHA publishes on their website, and I also routinely send you midweek when that becomes available. And that shows how each county and overall the state is doing on make that 6 specific criteria that the state collects data on. So that dashboard is always available for you or the public to look at, and will give Lane County numbers. It includes things like our positivity rate, which is a key factor of all of the tests that we're doing in the community, how many are coming back positive. On the last report, Lane County had a 0.8 positivity rate, which is significantly lower than the counties in Oregon or statewide. And then we look at hospitalizations. As I said, that we currently have 1 person in the hospital, but that's also tracked on that statewide dashboard. We look at sporadic cases, and we look at our infectious numbers. So I noticed Commissioner Sorensen had a hand raised. I don't know, Commissioner Buck, if you want to take questions now or you want me to keep going.
Why don't you finish your presentation? We have about 9 minutes before our time certain. And then after our time certain, we can come back and do some questions.
Fantastic. I'm happy to do that, and I can wrap this piece up before you need to take your next item. So that's the status around cases. The second element the board asked us to track on was hospital bed and ICU capacity. And of course, as we see increased cases, we want to track on that. And we do continue to be in close communication with the hospitals. They, because our hospitalization rate has been low, they are definitely within their resources, and they have solid plans to surge for capacity if that's needed. The third piece was around testing and infrastructure for testing. At this point, we've completed more than 26,000 tests of people in Lane County. And as I said earlier, we've had 243 of those that came back positive. And our average daily test rate is exceeding 500 tests a day for the last several weeks. And again, that data is available on our website for anyone who wants to track that on a daily or weekly basis. As you know, we do not have our own lab. So we rely on labs in the commercial sector, our hospital labs, and then of course the Oregon State Public Health Lab. We have continued to be working on a project with the University of Oregon. As you know, you've issued a letter of support for that project as they work to get FDA approval and then roll out a mass testing system that will be managed through the University of Oregon. They're still awaiting FDA approval on that, and we have executed our contract with them to be in support of that as soon as it's ready to roll out. So we look forward to having increased testing capacity when that comes online. And meanwhile, we are working closely with particularly Mckenzie Willamette Hospital. I just want to thank them again for making their testing available to us as part of our public health sponsored Reservoir testing. And I'm happy to answer questions about what we're finding in that when we get to that period. We've gone to rural communities. We're this week doing specific testing with our Latinx communities. And given where we've seen cases most recently, cooperating with Lane Community College and the University of Oregon to do some targeted testing for college age students. And then finally, the last piece was around PPE. And I will say that our current supplies for our frontline workers are not of concern. However, we need to continue to build stockpiles. As we know, if our hospitals get hit significantly, the demand for that PPE will increase. So we continue to work closely with state emergency management and our first responders and hospitals to make sure we're pulling down sufficient PPE and also testing supplies at this point for all the reservoir testing that we're doing. And since I have a few minutes, just as the PPE piece makes me also want to reference the important work that's happening with schools and businesses in our community. We know that as the state has implemented a mask requirement, and many, even prior to that, many businesses were moving toward requiring masks in indoor spaces anyway. There is pressure on the supply chain specifically around masks. So we monitor that closely. We are cooperating with the state in an initiative they have rolling out to help get masks into the hands of small business partners. So we're cooperating on that distribution with our city partners. And we are working closely with the schools, both higher ed and K-12, in their efforts to prepare for the fall. You may have noticed in the Register Guard, there was coverage about LCC working through their draft plan. We have met with them, provided initial feedback, and they're continuing to refine their plan for the fall. The same is true with the University of Oregon. And then actually starting in about 4 minutes, is our twice weekly call with K-12 partners for the last couple weeks and moving through August. Public Health is hosting with the ESD a call every Tuesday and Thursday morning with our K-12 partners who are working on their reopening plans, just to make sure they have easy access to public health consultation as they prepare those plans. And each school will need to submit their reopening plan, and that's building specific, whether they're private or public, will need to submit that for review by public health prior to their submission to the state, and those are due August 15th. So I think we will soon have a more clear sense of what some of the schools are planning for the fall. I'm going to stop there, Chair Buck, and I don't know if you want to take a question or you just want to put me on pause for your next item.
There's a question that can take maybe 3 minutes or less. We can do that. Otherwise, we can go to the next one. Commissioner Sorensen.
Thank you so much. I'll just ask a open-ended question, and Ms. Gaffney can, it's got two parts. Why are Lane County's rates lower than other metropolitan areas of our size? And secondly, what is the status of pooled testing in Lane County by Lane County Public Health?
Thank you, Chair Buck and Commissioner Sorensen. We've been asked a lot, why are our rates so much lower than other comparable cities and counties? And I think it's a combination of things. First of all, Oregon in general, it has lower rates than the hotspots we're seeing in the country. So I think there's a piece that we can credit the statewide policy work that has happened in really helping keep rates in Oregon down. And then I think there's been a lot of hard work here in Lane County in terms of our public health response and the community responsibility that has been taken as people have really taken to heart our asks of them in terms of hygiene and distancing and staying home. I think we've done a lot of good communication around that. And then I have to also say, I think there's a piece of it that we've been really lucky. So while it would be fantastic for the county to be able to take total credit for the fact that our numbers have been relatively low, I think it's really been a combination of our hard work and catching some breaks our way, I have to say. We have done significant contact tracing from the beginning of this outbreak. So I know that in terms of the tools that are available to public health, quarantine and isolation are significant tools for us. So that helps us contain the spread. And we have had great cooperation from our testing partners, those labs in the community, to help us meet our goals around really expanding the number of people who are tested, because we know the sooner we can find people who are positive and move through that process of quarantine and isolation, the better off we will be. In terms of pool testing, I know there's someone in the community who's been asking a lot about that, and Pat Ludke, our health officer, has responded a couple times about pool testing that really happens in laboratories. It's not, we do not have our own laboratory at Lane County. So we really rely on our lab partners to implement those systems. So I think my short answer, given the time, is that since Lane County does not run its own public health lab, we're not really in a position to do pool testing or other testing ourselves. We just don't have that equipment.
Okay, let's pause on our COVID conversation for our 10 a.m. time certain item. In the meantime, we can think of any other questions we have for Karen Gaffney or Steve Mccroskey. So we're moving back to item 7A, which is the second reading and public hearing for Ordinance 20-04 in the matter of amending Chapter 8 of Lane Code to extend the term and franchise agreement with Comcast of Oregon, I think it's II, for operation of a cable communications system to December 30th, 2021, deleting and replacing in their entirety Ordinance 12-07 and Ordinance 18-09. And with us is Christine Moody, our financial planning manager.
Yes, thank you, Chair Buck, Commissioners. So I'll just briefly reiterate what this item is about. So we had the first reading. You may remember that this previously came to the board. The original franchise agreement expired on August 1st of 2018. Ordinance 1809 extended that through June 30th of 2020. And this is a franchise that is in combination with our two largest cities, City of Springfield and City of Eugene. So the three jurisdictions work on those to renew the franchise together. Since we came to you with the last ordinance extension, there has been an FCC order that made some changes to the Cable Act. And then we've still continued to have discussions about one specific clause in our agreement related to competitive equity. So we're at a point where we have not been able to come to agreement. We haven't been meeting most recently, and so we need to extend again. So we're requesting to extend to December 31st, 2021. And just so you know, both cities have already passed this extension for their jurisdictions. And that is all I have.
Okay. So this is a public hearing. Today's date is July 7th, 2020. The order of proceedings for the hearing is the report by staff that you just heard, followed by any public testimony, and then any additional comments by staff. Participants are encouraged to raise issues or concerns with sufficient specificity to enable the county to address or respond to them prior to the board's deliberations. I'll now call for disclosure of any board abstentions due to any conflicts of interest or biases. Are there any declarations from commissioners? Seeing and hearing none, we'll call for any challenges to the board's qualifications to hear the matter. Are there any challenges? Okay, seeing and hearing none, we will open our public testimony period, and then we'll have any additional comments by staff. If there's any testimony, I'll turn it over to our moderator.
Chair Buck, at this time, I do not see that anyone has signed up for public testimony for this item.
Okay, any other final comments by staff?
Thank you, Chair Buck. I do not have further comments.
Okay, we'll close the hearing. And now we can have some discussion by the board. The first option, there's a couple of options we can do. We can either approve it as presented or move for a third reading with any changes. I will entertain a motion to approve ordinance 20-04 as presented, unless there's an alternate. Commissioner Sorensen.
Thank you so much. This time I'll move approval of the order as presented.
Second.
Moved by Commissioner Sorensen, second by Commissioner Burney. Any further discussion? Seeing and hearing none, I'll call for the vote. All those in favor, please say aye.
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 An ordinance.
Oh, I even wrote roll call. I forget every single time. Please feel free to do that.
Yes, okay. I'm just gonna go across my screen from left to right here. Commissioner Sorensen,
Aye.
Commissioner Burney,
Aye.
Commissioner Bozovich,
Aye.
Commissioner Farr,
Aye.
and Commissioner Buck.
Aye.
It's 5-0 is the vote.
Okay, motion passes unanimously. We can move back to our COVID response. And any further questions we had for Ms. Gaffney or Mr. Mccroskey? Commissioner Burney.
Several questions, and Karen, I know I wrote you telling you one I was going to ask, so thank you for responding to that. Is there any status on the state providing timely, targeted, and temporary liability protections to businesses that are reopening?
Chair Buck and Commissioner Burney, I have not heard that that is happening, which doesn't mean that it isn't happening, but I have not been told about that being forthcoming in the short term.
Okay. for the board's edification, that's a big deal as it relates to being in phase 2 and reopening for those. It's not just businesses, but businesses and other places that people congregate that are trying to abide by the dictates and the instructions. And in so doing, if they make mistakes, they become vulnerable to liability lawsuits. And that's what this is attempting to get in front of. Too late to get in front of it, it's attempting to intervene. Another question, I believe a couple of days ago, the American Pediatrics Association took a position that for public health, for a variety of factors, schools should reopen this fall. And as you mentioned, Karen, due to hard work, good work, little luck, great resources in the community that have been mobilized, we're doing about as good as anyone in the country. So my question is, and you shared how coordination is going, but we've got 16 school districts in Lane County. I mean, one of the issues here is we have no coherent national plan that everyone is abiding by. And so all these decisions get pushed down in the context of a health pandemic. My question is there, other than just knowing what schools are doing, is there any coordination where the county's public health professionals are guiding schools in developing those plans, and it's the same guidance, and the schools in fact are coordinated and are reopening this fall? I'm really curious what the status of both the process and the desired result is, because of course you can't separate that from parents being able to work. It's, you know, everything is related to everything else. So I'm curious about that.
Thank you, Chair Buck and Commissioner Burney. So I'm going to answer the first part of your question because I think it's briefer, and then I want to talk about guidance for the schools. There absolutely is significant tension in terms of public health impacts for keeping schools closed. We know that having a good education is critically important to kids, and we want them to be in environments where they can learn, and that I think the disparities get widened for kids if we are in a distance learning environment. So that is far from ideal for kids to be able to get the very best education. And that gets balanced with how do we contain the spread of disease to protect not only those children and those teachers and other staff who are in that environment, but then in terms of spread in the larger community, we know that having people in close contact just increases the likelihood of spread of disease. So each community, each state, and each school is really working to balance all of those pieces to figure out how do we best do this work. So Oregon does have consistent guidance that goes across the state for all of our schools, not only public schools, but also our private and charter schools. And for those in the public who might be watching, if you go to our COVID coronavirus website on the Lane County page, you'll see there is a tab that's specific to schools. And at that place, we've tried to collect links to some of the most important documents for people who might be curious about guidance for schools. And one of those is to the Oregon Department of Education, Ready Schools, Safe Learner Guidance for the school year 2021. So that does set up a framework for all of our schools. And you mentioned that Lane County has 16 districts, which is true. The school return to school plans in the fall actually need to be site-based. So it's not just each district, but they need to look at each school inside each district to figure out what their plan for reopening is to provide education in the fall. And I'll just very quickly give an overview of that for people who might be watching. Each school is required to respond to 8 specific elements in their operational blueprint. So they need to describe their public health protocols, and there's specific elements within that section. Section number 2 is around facilities and school operations. So all of the the specifics of arrival and dismissal and classrooms and meals, all of that falls into facilities and schools. The third is their plan for response to outbreaks. So if they get a case, what will happen then? The fourth is to address equity issues and really articulate a decision-making process that centers on equity. The fifth is to describe their plan around instruction, and that's instructional time and models, considerations. 6 is on family and community engagement. So how does each school partner with its parents and communicate really clearly about how school is going to work next year. The 7th element is around mental, social, and emotional health. And then 8th is around staffing and personnel. And so that includes both supports for staffing as well as public health training and professional learning. All of that is a lot of planning to ask for our schools. And I would say that the plan for reentry will vary based on, I've heard, schools grappling with facilities concerns. Some of their buildings are really old and have poor ventilation. And so that's going to be a different set of circumstances to address than some of our schools that are in newer buildings. Some schools have really great Wi-Fi access and broadband internet access. So distance learning might be an easier alternative in some areas than others. So the schools have 3 basic choices in front of them. The first is to do complete distance learning again. And if they're going to do distance learning, it really needs to be within the context of enhanced professional development and better systems than what people were able to put together on the fly last spring when schools very quickly closed down. So they can be 100% distance learning, or they can be 100% bringing students back into the classroom, or they can adopt a hybrid model. And I know some of our schools are thinking about, how could they do the best of each of those? Maybe have an A-B schedule where half the students come in one day and then the other half come in the next day. So each school and district is doing the work right now to figure out what's going to make the most sense for them. So I would say there are statewide standards and guidance, but each district is going to design a plan that works for them.
So if I may, will Lane County Public Health, without getting into all the myriad of site-based planning decisions, will Lane County Public Health be coordinating that from a public health perspective with all those criteria with every site of every district in Lane County?
So Lane County Public Health's focus is on the first 3 of those elements that I talked about. So we're working with districts on the element number 1, which is specifically their public health protocols. Element number 2, their facilities and school operations. And element number 3, their response to outbreak. So those are the 3 parts that we're focused on. And we are coordinating with them. We cannot tell them what to do because we're not educators, but we absolutely are giving them the public health guidance on that in those 3 areas. And we're providing that largely through these twice-a-week calls. However, so that's one piece. We are providing targeted training for them, for their staff. So we're doing online video-based trainings that they'll be able to use in helping their staff learn how to do things like symptom checks and other things. And then the third piece is that when there are draft plans available, we are reviewing each individual draft and giving them specific feedback about the response in those 3 areas. And if there are places where we think the plan is insufficient, we will give them that feedback and ask them to adjust those plans, again, focusing on those first 3 areas.
Thank you. I'm going to change the quick subject. This is my last one. You talked about PPE and you talked about needing to keep those supplies up. There's an intersection between supply chains for any product and local economic development. I personally am aware of people who are manufacturing masks here, and I'm also aware of distilleries that have changed their business plans and are manufacturing hand sanitizers. Is there a is there a priority to procure from local sources where items are locally manufactured and keeping up with local jobs?
So I would say for the PPE that Lane County is acquiring, and again, we are in a position where we're asking everyone to develop their own supply chains. So we are not acquiring for all of the healthcare providers or all of the businesses or all of the schools in the community. They are acquiring their own. What we acquire is for our Lane County public health use, and then for an emergency stockpile. Much of that stockpile comes to us through the state and what they have acquired. So that's PPE that we don't need to pay for. For instance, I mentioned earlier test kits, that we're able to access those through the state stockpile and through emergency management, and those just come down to us. For the areas where we are procuring, I know historically we have contracts with medical suppliers, because that's the kind of PPE we need. During this emergency response, we absolutely have acquired hand sanitizer from local producers. I don't know off the top of my head about medical grade masks, if those have come from local suppliers, but hand sanitizers and cloth masks and those elements, I know that we have used local suppliers in that. To actually have details about what percentage of that, I would need to talk with our folks in our logistics section to get that.
Thank you. I know I've taken a lot of time. My last 2 points, and these are not questions, are we absolutely have to start walking our talk. And when there are opportunities for Lane County to purchase, we need to start looking at how we can purchase locally to create local jobs and support local businesses. When we're getting supplies from the state, we need the state to start doing the same thing. I think that message needs to go to the state. This is but one of multiple supply chains that we have the opportunity to change. We can have an equity lens in terms of business ownership, but we need to invest dollars in our communities for the multiplier on that particular one. I've taken way too much time. Thank you.
Commissioner Farr.
Commissioner Burney, no, I don't believe you did. I think you asked some very pertinent questions that were provided with answers that otherwise we may not have gotten if you hadn't asked those questions. So thank you for that.
Thank you.
I only have 3 items, but they're in 22 different parts. No, just kidding. The first thing is just that to Mr. Mccroskey and Ms. Gaffney, thank you for your daily or almost daily reports that you provide both to the board and to the people who work in Lane County. You know, I hear anecdotally, Mr. Mccroskey, regarding your report, I hear from the people who work in Lane County that it helps them not only to address their individual, personal, and family needs, but to respond to people who ask them questions, their neighbors, other members of the community, who may ask them questions where they're able to actually provide factual data and other reports that you and Ms. Gaffney provide on a daily basis. It really is a tremendous service that if we all read those reports on a daily basis, if people did and staff did, then we'd be able to answer questions without hedging the answers. So Ms. Mccroskey, Ms. Gaffney, thank you so much for that. I really appreciate it. The second is regarding schools. You know, Commissioner Burney, we do have 16 school districts in Lane County. One of them has 4 high schools, 2 of them have 2 high schools, and the rest of them have 1 high school. I attended a board meeting last night, and I know you know this because you're closely attuned. We're all closely attuned to the schools in our districts. But at the board meeting last night, the questions that you raised regarding how do they begin school in the fall, what are the steps? They take that very seriously. You know, each district has an elected board of directors. Each district has a professional superintendent and many, many professional staff who have a single responsibility. We as county commissioners have broad responsibilities, many responsibilities. And they have a single responsibility, and that's to the kids. And I know you know they take it very, very seriously. And I think we're in very good hands with the school boards and with the superintendents and staff who are in the schools, helping us receive feedback from them as to what the county can do as a health department, as a board of health. So your questions were great, Joe. Thank you for asking those. The last item that I have, I could speak about a number of things, but really last week there were a number of COVID-related demonstrations in front of the Lane County Jail. In fact, every night. And really the basic discussion that was the presentation that was being made was regarding the safety of the people who both are residing in the jail and who work in the jail regarding COVID. And so I became very concerned, in no small part because 5 names and 5 telephone numbers were given out. Actually 6 if you include Sergeant Carver, who's the Public Information Director for the Sheriff's Department. So those 5 names, Commissioner Sorensen, were you and I. We're also Sheriff Harold and Sheriff Harold's wife, and the 5th name was actually it was Sergeant Carver. So excuse me. So we're because I'm saying I did that. Thank you, Jay. It was Commissioner Lycan who was given as the 5th name, which kind of gives a little bit of information as to the data that was mined to get those names. So Commissioner Sorensen, I'm sure you experienced the same thing that I did. A lot of telephone calls over the weekend. And we also all received a lot of emails regarding what is the safety in the jail? What is happening with COVID-19? A couple of weeks ago, and this is related to the subject that we're on right now very directly, because we're talking about specific populations and we're monitoring outbreaks in specific populations. The jail, our jail has a specific population of people who have limited choices as to how they congregate, limited choices as to how they spend the night, and limited choices as to basically what they do on a daily basis. So it is a population that we are responsible for, along with the other populations that we're monitoring. So with that population, I did ask the sheriff to give me an update on what was the report that he provided to us a couple of weeks ago, 2 weeks ago, regarding COVID-19 and the response in the jail. And just very briefly, and this is in response to the questions that have been asked surrounding COVID-19 from the people, mostly from Portland, by the way. My phone calls have been mostly from Portland, and I have answered most of the phone calls. I received a couple today that I've not answered yet. But most of the people are from Portland. In the jail, the population of the jail has been reduced from 382 to 260. There are 255 single cells in the jail, in addition to the dormitory housing, and the dorms are currently being occupied at no more than half of their normal capacity to allow for spacing. There's room for physical distancing. Folks in custody are reminded, but they also have a personal responsibility to distance accordingly. But the spacing has been provided inside the jails. And the people who are living in the dorms have the option of requesting single cell sleeping accommodations. So everybody in the custody has been tested for COVID-19. Everybody in the jail, they've conducted over 800 tests so far. They've only had a single positive test in all of the tests that have been conducted between the staff and the inmates who have been cycling through the jail. That one person was transferred from a different county because that person had to see a judge face to face here in Lane County, or through glass here in Lane County. That person tested positive. It had no contact with the other people housed in the jail. So our jail is following federal, state, and local health guidelines, and we do have a single person in the jail who is on a hunger strike. You've probably heard that, and much has been made of it by the people who are sending our notes. It is a man who is conducting a hunger strike. That he is, by this report, currently taking Gatorade and other liquids, so not on a hunger strike for liquids, and food and 24/7 medical services being provided and offered to that individual. I'll keep an eye on that. So that's basically the rundown on the jail. Now that doesn't mean that we're doing every single thing that we possibly can do, but it really does answer, I believe, the questions regarding how are we addressing the confined population who are in our jail. Now we may have other questions regarding that, and the words came directly from Sheriff Harold. If you look at your email this morning, he responded to one of the individuals who had sent a request regarding COVID-19 in the jail. So that response that he provided this morning to all of us, I believe it was to all of us, it was written specifically to Commissioner Sorensen, but I believe we're all copied on it, really gives a little bit more detail on the bullet points that I just made. So I'm sorry to take so much time on that, but once again, Ms. Gaffney, it is a specific population that we're looking at here, and it's a confined population that has very limited choices as to how they congregate, very limited choices as to how they spend the night. And it's important that we are making certain that they are protected as people who are free to walk around our streets. So thank you for that. And Chair Buck, thank you for the indulgence, allowing me to go a little bit over my time.
Commissioner Bozievich.
Thank you. And I know Commissioner Burney is going to appreciate this next statement. Data without context leads to inaccurate conclusions. And a lot of the data around increases in cases is being put out there without context. One of the contexts is the increase in testing that's happened locally, statewide, and nationally. Back when we were peaking in our hospitalizations for COVID-19 in the state of Oregon, Lane County was barely doing 100 tests per day. We're up to 600 per day on weekdays now. Of course, we're going to identify more cases. The inclusion of the presumptive cases in our case count is another place where you have to understand that context to understand the fact that what's being reported today can't be compared apples and apples with what was reported a month ago, because we weren't including presumptive cases a month ago. The redefinition of what recovered is, and the new designation of infectious has also even changed some of our case count data. What is kind of an important thing that hasn't changed and is probably a better place to look at understanding this pandemic is hospitalizations due to COVID. That definition has not changed. The reporting nationally has actually shown that peaked back in mid-April. In Oregon, it actually peaked at the end of March. And that has actually been decreasing over time despite the increase in reported cases. I'm going to do something I don't normally do, and it's try and show people a picture off of my iPad. But that's the national hospitalizations. Let's see if I can get that to show well. That's national hospitalizations. CDC reported. You can obviously see it's a decreasing number. Now, Oregon has a slight increase that happened about a month ago, but it's starting to trend back down again. So some of this talk about, are we going to close things back down, I think is way premature if it's purely based on case count. Because case count is by itself a changing set of statistics. It's based on how many tests we're doing and how we're qualifying what's included in that case count, like presumptive cases. It's also even changing somewhat in how we determine to take people off of the active COVID list because we've changed the definition of recovered. So I would have to say that right now, yes, we have a lot of cases that have come up, but we are actually looking at, not as severe number of cases because all along we had been under testing. And the actual hospitalization rate has been different. There are other things that are coming out now too, like the recent study by the Henry Ford Hospital in Detroit, peer-reviewed and done in a very scientific method that shows actually that hydroxychloroquine actually reduces fatalities in hospitalized COVID patients without heart issues. And that's a study that was just published a couple days ago. So, the understanding of the treatments is even getting better as we go along. So I say all this because I want to, let people know that purely staring at the number of cases is going to give you bad conclusions. And understanding the number of tests that we're doing now, understanding the changes in definitions and all that, I ask people to watch the hospitalization rate and watch the death rate. Those things can't be really monkeyed with too much.
and are probably a greater indicator of the severity of the pandemic. That all said, the real issue, and it continues to show up in all the statistics, is the mortality occurs with age. The higher your age is, the greater your chance of dying of COVID-19. And in addition, folks that are vulnerable and have other complicating medical conditions also have a higher mortality rate. So instead of looking at shutting down our economy again, I think we need to concentrate on how we're going to protect those older and vulnerable populations. So as I'm hearing about school reopening, the one thing I did not hear was, are we asking parents and students, do they have elderly grandparents, or are they actually living with a grandparent, as we allow these kids to come back to school? What is their family living condition? Are there vulnerable people in their household? What are we doing to specifically increase our testing of nursing home and group home living staff and patients, where those folks are concentrated? Because that's really where I think we can get the best protections for our public health dollars, is if we can start concentrating on those populations that have the high mortality rates from this disease. And I'm kind of not hearing that much. So Karen, if you want to address how we're protecting those vulnerable populations, and if maybe we can wrap something into the school reopening plan that also talks about, obviously there is very low mortality in school-age children from this disease, but it's about whether they bring that home and expose somebody that's vulnerable. What are we doing relative to that in nursing homes here in Lane County?
Thank you, Chair Buck and Commissioner Bozovich. And I didn't talk about long-term care facilities, so I appreciate you bringing that into the conversation, because you're absolutely right in terms of risk of death or serious complications. Age is a huge contributing factor. And we, as you probably remember, part of our efforts around our reservoir testing have included long-term care facilities. And in mid-June, the state of Oregon adopted its long-term care facility testing plan. So the state, in basically a collaboration between Department of Human Services, which is the agency that regulates long-term care facilities, and the Oregon Health Authority, have adopted a joint plan that provides for regular testing of all residents and all staff in long-term care facilities. And I think we have linked that on our website, although I'm not certain of that. It certainly is available on the Oregon Health Authority website, and it provides, a standard for rolling those tests out, and the actual testing is the responsibility of the care facilities, and then local public health comes in as a cooperating partner if they actually have any positive results, and of course assist them with the disease investigation and contact tracing work. So they are required to do initial testing and then a rolling follow-up test that is 25% of their staff, I think weekly, although it's been a little while since I've read through this to know exactly what their retesting rate is. Lane County, because our relative disease burden is significantly less than many other counties in the state, was not in phase 1 of the plan. So that testing is coming to us after they have completed the intensive work with the counties that had such significant outbreaks in their long-term care facilities. But that's how that ongoing testing will be happening, and all nursing facilities in Oregon need to be completed by week 9 of their plan, and that clock started in mid-June. So we can expect that that's going to happen here as soon as they complete facilities in Multnomah, Washington, Clackamas, Yamhill, Marion, and Polk are their priority counties based on highest risk of experiencing outbreaks. So that is a very important population. And then as it connects to the schools, I think I would say a piece of the work we've been connecting with schools on is the communication piece. So again, each family has their own set of circumstances and the need to weigh their own risks as they move through this. So our commitment from a public health standpoint is to make sure that the schools have the best up-to-date, solid information to provide those families for them to be able to make the choices they need to make in terms of how best for their child to either do distance learning or to return to the classroom. So that would be the local public health role in that.
Thank you, Karen.
Okay, I think it's time that we kind of wrap this up. So Commissioner Sorensen?
Couple of things just on the age thing. I think Commissioner Bozovich basically is hit it correctly in that the under 40 death rate is close to 0. The 30, the 50 to 60 death rate's close to 3% of people who get between 60 and 70 jumps to about 6%, over 70, 10%, over 80, 15%. So it goes up pretty rapidly for those people in the 65 plus age groups. And secondly, I do want to point out that the death rate is not only increasing in Oregon, but also is projected to increase. For example, at June 1st, we were about 1.3. We are now over 2. And our projection for October 1st is 5 per day. So again, the projection is for an increase. And just to put it into some context, we've already been at 3 as of April 22. We were at 3. So we've come down on deaths per day from 3 to 1.3, but now we're starting back up. We're at 2, and we're projected over the next few months to go to 5. So I do think the death rate is increasing. Now the numbers are small, but as was pointed out, it's hard to argue all the other things. Death is sort of the ultimate measurement of the lethality of this disease. So anyway, we are projected to get increased deaths per day in the state of Oregon, and we have experienced a rate, death per day rate that is 1.5 times of what it was just on June 1st. Thanks.
Okay, and I just want to remind everybody who's watching or listening that you can get sick from COVID-19 at any age. As we know, we've had a lot of young folks who've been testing positive and getting sick. And as a result, we've had a lot more activity through our contact tracers. And I want to give my profound thank you to all of our contact tracers working for Lane County Public Health, including all the volunteers who spend their extra time down there helping with contact tracing. We know that people could be doing lots of other things with their time, but this is so very important to our community and our state at large. So my deepest thanks to all those contact tracers. We will now move on to the next item, which is 7C, a discussion regarding the update on our COVID-19 rental assistance and rental housing moratorium legislation. And with us is Steve Manila, our Human Services Division Manager, and Alex Kyler, our Intergovernmental Relations Manager.
Good morning, Chair Bush, Board of Commissioners. It's my pleasure to update you on our activities related to rental assistance and the economic impacts and health impacts on the housing stability of the COVID-19 pandemic. And then also to address some of the items that were brought up by the Springfield Eugene Tenant Alliance. We last had this discussion on June 9th and a request to come back. I will go into a couple of these pieces in some detail, and then Alex Kyler will address other housing related legislation that came up during the special session, and we'd be glad to answer any questions that you have. In June, Lane County opened its rental relief program with $930,000 of state funding made available by the Legislative Emergency Board. To date, we've distributed 42% of those funds. And in relationship to the request earlier by Commissioner Bosevich, we do have data on how much was allocated to each agency, both for this portion, and then additionally, Lane County was allocated $6.1 million of federal funding that will be made available beginning on July 15th. Lane County is contracting with nonprofit community-based organizations, and this morning you approved some additional contracts. And to date, the total that we have contracted to the nonprofit agencies between the first round and the second round of rental relief dollars is $5,787,000 in total. There was a question earlier from Commissioner Burney about administrative costs for the infrastructure of the nonprofit organizations, and the state has capped the direct costs at 5%, although they have a process that we can go through as we put together our plan, where we can request a deviation from the 5% cap to be reimbursed for all the direct costs related to administering the program. When we open on July 15th, we will both continue to have call center access for people who cannot maneuver on the web, and we will have a web-based application, a little bit different from the first round. We had a survey that people filled out to determine their pre-eligibility. This time, people will be able to complete the complete application online. They'll be able to attach documents. We are very hopeful, and we believe that this will increase the efficiency of getting these applications approved and the rent checks to the property management companies and to the landlords. We also have been discussing with Homes for Good their ability to participate in this project. This has required some reflection on their part, in that their systems are set up for very specifically for the Section 8 program and the parameters around the Section 8 program, and they still have some questions about the ability for them to flex in order to take on some additional workload. We have we've put in place, we have a temporary program services coordinator and office assistant, as well as we have folks that have volunteered from other county departments, namely from Public Works, who have the ability to, Public Works has made available some staff that are able to help us in getting these applications reviewed and getting the rents paid. So feel like we have a good implementation plan on that. Now on to the eviction moratorium. When we last talked on June 9th, we were looking at a situation where the state of Oregon's eviction moratorium was ending. The state of Oregon eviction moratorium has been extended now by the legislature with the passage of House Bill 4213 on June 26th. Under this new law, no landlord in Oregon is allowed to do any of the following things until October 1, 2020. They're not allowed to give a termination notice for non-payments of rent, fees, utilities, or other charges, charge a late fee or penalty for non-payment, give a termination notice without cause, unless the landlord has sold the rental to someone who plans to move in. Then in the case of a sale, a termination notice without cause can occur. They cannot start an eviction case based on non-payment, start an eviction case based on termination without cause, file for non-compliance with the stipulated agreement in an eviction court, report a tenant to a credit agency for non-payment of rent or late fee. There's also a rental grace period that is between for rents that became due between April 1st, 2020 and September 30, 2020. They must be paid no later than March 31st, 2021. Starting on October 1st, tenants need to pay their rent each month under the terms of the rental agreement. They'll have 6 months to pay that rent. Specifically, with this new right that has been given to these tenants, the legislation also put in place a responsibility on the part of the tenants. If the landlord gives them a statement, and starting on October 1st, 2020, the tenant has to give notice to the landlord within 14 days of their plan to repay the rent during the 6-month grace period. If the tenant doesn't respond to this notice, then the landlord can take legal action. So there's a responsibility on the part of the tenant as well. I also want to mention before I close on my part that the dollars that we have to date in state funding and funding from the Federal Corona Relief Fund are only a portion of the rental assistance funds that we will receive. We also are in the process of programming the Emergency Solutions Grant dollars from HUD, which will be over $6 million, which can go towards shelter, rental assistance for homeless prevention, rapid rehousing, and homeless outreach. And then additionally, there's been legislation passed in the House under consideration in the Senate as a part of the action to have additional COVID-19 relief that the Senate will be taking up in September of $100 billion worth of rental assistance. I think last time there was also a question about data regarding, and I think Commissioner Sorensen had asked this question last time of me, and now I have some actual data. There's a monthly multifamily Northwest rent survey that's being taken. And it doesn't have Lane County listed, but it has the Eugene market listed. And for May, for conventional rental units, there was a non-payment rate of 8.7%. For the low-income tax credit units, there was a non-payment rate of 9.7%. And for June in Eugene, there was a non-payment rate of 11%. And for tax credit projects in Eugene, there was a non-payment rate of 8.5%. So that's my update on those items. And I don't know how you want to do this, Chair Buck, if you want questions on my part or if you want to wait until Alex.
Yeah, why don't we have Alex go next, and we can think of any questions to ask when he's done with his presentation.
Thank you, Chair Buck, and members of the Board of County Commissioners. Alex Kyler, the Lane County Intergovernmental Relations Manager here. You should have in your packet a report that I did on housing related issues that were taken up during the special session. Before I get going, Chair Buck, would you mind if I just go back and answer Commissioner Burney's question about liability while I'm got some?
Sure.
So, Commissioner Burney, you asked about and expressed concern for liability exposure for both local governments and business entities during the COVID pandemic. There was an amendment during the special session to a bill that we think would have provided some really excellent relief for us in that regard. Unfortunately, that amendment did not advance. There was a lot of testimony on the amendment. It was both bipartisan and bicameral, but it did not advance. Instead, a work group has been formed, and there is a county council from Marion County who is on that work group, and they are working towards establishing a recommendation for the next special session, which we believe will occur either at the end of this month or early in August. So there's no guarantee that that will go, but at least there was recognition of that issue.
Thank you very much, Alex.
Okay, so back to my report. I think Steve did a very nice job with 4213 relating to evictions. I do want to just add two things to his report. One is that that measure does apply to both residential and commercial rental agreements. Okay, so that covers both commercial and rental. The other thing is that he talked about this notice that a landlord may provide. And this is what sort of makes me a little nervous about this legislation, is that if the landlord does provide notice that and what they're asking for is that they're saying you need to pay me my back rent within 14 days. However, if the landlord presents that demand, a tenant may respond, or can respond, must respond in writing and say, I intend to take advantage of this 6-month grace period. So I'm a little bit nervous that maybe tenants will be under the impression that they've just got this grace period and potentially will ignore a notice that a landlord may or may not send. So if they don't send it, the grace period is automatic. If they do send it, they're trying to collect their money within 14 days. And the only way that a tenant has out of that is if they respond in writing that they intend to take advantage of the 6-month grace period. So it's a nuance of the bill. Like I said, I'm assuming that advocates for renters will try to make sure that everybody understands that, and the legislation does require that the notice that may be provided by the landlord outline that issue, but it's a little complicated, to be frank. So there's that. There's two other bills that I thought you would be interested in. 4212, House Bill 4212, had a very broad relating to clause relating to strategies to protect Oregonians from the effects of the COVID-19 pandemic. This bill was considered to be the omnibus bill for the session, and it was into this one that the amendment was being tried to pushed into it for that liability concern. There's an important part of this bill, however, that has to do with emergency shelter, and this was language that essentially came out of House Bill 4001 during the special session, which we were following very closely because it would have provided a number, well, it would have provided some dollars and a number of other policy implications for the siting of emergency shelters within the UGB of a city or within land zoned rural residential of a county. So the good news is that the policy language did make it into 4212. We actually had named funding for Lane County in the short session, but of course that was adjourned abruptly. So there's no discrete funding in this bill, but the policy that's very important is that there's a supersiting authority given, and that means that a local government does not have to abide by land, particularly zoning regulations when it cites an emergency shelter. This is important for our facility at 100 River Avenue, which is zoned commercial and does not, under the zoning, allow for overnight stays. And so what we will do with this new language in 4212 is apply to the city of Eugene for a waiver of that zoning. And we must do that within 90 days, according to this bill. So that work is being undertaken. And we have this pretty narrow window to have the city waive that zoning requirement. And that should really make that facility be able to perform the way we had envisioned it. There is some interesting language as well in that section that does allow the Department of Administrative Services to award, it says it may award grants to local governments to plan, develop, construct, lease, and operate a navigation center. So that's some interesting language. It's a may, not a shall, but depending on how things go with federal funding, we may be able to see some additional resources for local governments come out of this measure. The final bill that I thought was important for you to understand was House Bill 4204, which again had that broad relating to clause. And this bill actually does ban for a period of time foreclosures. Now, they're not foreclosures based upon property taxes not being paid, more so the mortgage not being paid. And this measure also applies to both commercial and residential loans. This bill also exists only through September 30th, 2020, unless the governor decides that she will establish a later date for what's called the emergency period. So it could be extended, but, and she must, if she's going to do that, she must give 30 days notice to that she's going to establish a later emergency period. So at any rate, this one, much like 4213, provides a window where foreclosures may not occur, and you know, pretty contentious actually for a bit there during the special session, but passed pretty handily. And I think you know, a lot of shout out on this one goes to both Representative Paul Holvey, who really helped develop the language in this bill, and Representative Julie Fahey, who carried it onto the House floor. So we saw quite a bit of local delegation work on each of these issues. So with that, I'll conclude my report on just the housing related measures that passed during the short session, excuse me, special session.
Thank you very much. So we can go on to questions, and I'll just ask commissioners if they could keep it short to moderate length so we have enough time for our last item before the noon hour. Anybody have any questions or comments? None? Okay then. Well, thank you, presenters. on this, Steve Manila and Alex Kyler. That was a good, thorough update, and I look forward to our next special session at the state legislature to see what more COVID relief can come our way. So,
Chair Buck, this is
yeah.
Chair Buck, excuse me, this is County Council. I didn't know if there was, I know I wasn't listed on the item, but I believe I sent the board some materials because part of the assignment was talking about potential liability. So no one asked any questions, so I'm assuming there are no questions from the board.
I don't have any questions, but I do have some comments that I'll probably share with you separately.
Very good.
Okay, we'll move on to our item 7D, which is a discussion on federal and state grants as the COVID-19 response transitions to recovery. And we have Alex Kyler again, as well as Austin Ramirez, our Community and Economic Development Officer, and Judy Williams, our Strategic Initiatives Manager. Feel free to start when you're ready.
Good morning, Chair Buck and Commissioners. Thank you for your time today. Also joining Alex and Judy and myself are Nevada Martinez-Warren from HNHS, Senior Program Services Coordinator, Linda Cook from Public Works, Principal Grants Analyst, and Mike Penwell, our Capital Projects Manager. As the group of staff we've been working with around the county who play critical roles in our abilities to pursue funding opportunities and different grant opportunities pre-COVID and also during the pandemic. So we thought it'd be important to have everyone here today for the item. Today, we'd like to discuss funding we've received to date, funding opportunities we are seeking and exploring, really how the strategic plan plays a critical role in our efforts and guides our efforts to pursue funding opportunities, and then some steps we're taking to move forward to really maximize county resources and bring as much resources as possible for our communities and programs that truly need it during the pandemic. So at this point to start, I'm going to pass it to Alex Kyler to update you on our CRF efforts and status.
Thanks, Austin. Commissioners, again, I think I'd refer you to the board materials that we submitted here. The packet, the memo itself is really full of information about a variety of funding sources and some successes and sort of semi-successes with respect to grants. As you'll recall, at the beginning of the pandemic, we came to the board and actually sort of created a little bit of a different process with respect to grant applications because of our expectation about the flow of federal resources in particular and how quick the turnaround might be for some of those opportunities. As this process has evolved, we've come to realize that it's not just federal resources. There were probably more resources that actually flowed through the state from the feds and then to locals. And so we tried to keep you updated with a weekly memo to the administrator that he's given to the board each week about where we are with respect to both federal and state COVID-related funding. And I've attached that also into your packet as attachment A. The big thing, the big money, if you will, has been a part of the CARES Act referred to as the Coronavirus Relief Fund. And this was a very large sum of money that went out to individual states. The state of Oregon got $1.6 billion out of that program. The challenge of that fund was that the legislation identified that it should be also sub-allocated to local governments, but it defined local governments as only those entities with over 500,000 population. And so in Oregon, Washington County, Multnomah County, and the city of Portland got direct allocations, and the rest of the local governments in Oregon were really wondering what to do. So I'm going to refer you to attachment B, which is just a bit of an infographic that sort of shows the path of advocacy that we've taken. And again, some successes, probably not quite as good as we would hope, but the story is continuing. Essentially, Oregon did ultimately agree to share some of the remaining coronavirus relief fund with local governments. And it did that via e-board activities. And that process became actually pretty workable for us. And we submitted our first request for reimbursement to the state of Oregon, to the Department of Administrative Services, and were approved for over $5 million of our initial expenses to deal with the coronavirus pandemic. Subsequently, the state has agreed to create a second tranche of funding that's a little bit more flexible. It essentially established a pot of money for each local government that it may draw down. And Lane County got $10.7 million that it may draw down in that action by the e-board. We really hope that we can get to a place where Lane County and other counties and cities in Oregon will be treated like the larger local governments, and that there will be a split of money that is subsequently suballocated. If that effort is successful, we could see some fairly significant new resources available to us. So, like I said, this continues to evolve. But the good news is we have gotten access to a fair amount of money, noting that we're also spending a fair amount of money. So when I think I'll close my part of this by just stating that while we call these dollars grants, and while we do have a team of people within our staff that is looking at all these funds, grants is a term we use, but some of these dollars are not really sort of a traditional competitive grant. More so, they are just dollars that are allocated to us is really the more appropriate way to think of them. But we do have to justify our expenses. And so there's sort of a combination of this reimbursement model and as well some formal applications that are being made. And of course, those dollars come with contract arrangements, particularly through the state of Oregon. And County Council Dingell has been dealing with some of those agreements, as have other county councils across Oregon. They do have some challenging language for us, and so we're continuing to work through those kinds of things. But I think in the interest of time, I'll cease right there. And if you have additional questions for me at the end of this presentation, I'm happy to answer them.
Very good, thank you.
Thank you.
I have several questions. Was somebody else wanted to chat on that one?
Yeah, we've got a few more presentation pieces, if that's okay, Chair Buck.
Yes, please do.
So thank you, Alex. In addition to the CRF, as he mentioned, there are several COVID-related grant opportunities at state and federal levels right now that different county departments and programs are pursuing. In addition to supporting the public health response to the pandemic, other funding priorities at this time include housing and rental assistance, energy assistance, cash flow support for businesses, and rural broadband. We're also looking at potential funding for different infrastructure projects such as Territorial Highway, Goshen, and several rural wastewater needs. However, much of the funding right now requires projects that prevent, respond to, and or treat coronavirus. So it can be hard to fit some of those infrastructure projects in the moment. It's also important to note there are several different types of grants being made available. So as Alex mentioned, there's the non-competitive, there are pass-throughs, there are competitive, which are most. There are several programmatic recurring grant programs, which a department like H&HS rely on during normal times for a lot of their services. And then there are also several grants where the county may not be the main applicant for eligibility reasons, but we play a supporting role for communities or providers where we may help them write the grant, we may provide letters of support, but they may be the main applicant in name. So each grant opportunity can vary widely. There are challenges we believe are important to acknowledge in pursuing grants. These include liability concerns, which I know the county administrator will discuss later in greater detail during his announcements. There are, the challenges of funding amounts that are announced versus what hits the ground. So when the EDA, for example, says there are $6 billion available, what's available to the Pacific Northwest is a lot less and is often competitive. There's also the unpredictable ROI, and we've seen that with some of our Business Oregon funding where we've applied for $1.5 million to support our businesses and we've received a little over $200,000. And so it makes it difficult to predict what types of resources are coming in and in what amounts. And then for infrastructure in particular, much of the current funding must be spent by end of calendar year, which for, energy assistance and housing assistance and business support programs is not a difficulty. That money is needed as soon as possible. But for some of the long-term infrastructure programs we're looking at, it just isn't feasible to spend all that money by the end of the calendar year, oftentimes. And then there's also limited capacity internally and regionally to pursue these. We have some grant writing staff, but they also rely on content experts to put together really strong applications. And these content experts are staff who are really in the middle of the response and recovery efforts. So it can be hard to pull them away from that important work. And then there's also the burden of administering these programs and then ongoing management, which often can be years of management and reporting. So I think, the numerous grant opportunities and the associated challenges, they're important to note. We obviously will still pursue these because of the great need, but it makes it all the more critical to be strategic about the opportunities we're pursuing, which is really where the strategic plan plays a critical role for our organization. I'm going to ask Judy to talk a little bit about the strategic plan and the role that plays.
Hi, Chair Buck and Commissioners. This is Judy, our Strategy and Integration Manager. Can you hear me okay?
Yes.
Perfect. I'm just going to briefly touch on the strategic plan as both Austin and Alex have touched on the resources piece, but just really thinking about how we can use the strategic plan as we're talking about grant efforts as really a guiding document, if you will. So, a way to really build that cohesion when it comes to focusing our efforts, using the most of our resources, and that's staff, money, and time, most efficiently and effectively. And so just really trying to show how we can tie our efforts into the strategic plan. And I wanted to also mention, kind of a caveat, if COVID-19 hadn't happened, I think we'd be in a world of different scenarios right now. But for one aspect in terms of the strategic plan, if COVID hadn't happened, I would have come to you with a quarterly report back in late March and really touched on some of the progress that we've had to date with the strategic plan and really go a level deeper into some of that project level, specific project status summaries that we typically do on those quarterly reports. But we do anticipate coming back to you in August with some of that detail. So I just wanted to put that caveat that while we do have an updated strategic plan, we have a little bit of work to get to that specificity as well. And in terms of how we've seen the strategic plan be successful in terms of some of these complex projects that might be a great opportunity for grant resources, we can look back to some more complex projects that we've had over the years, such as Goshen and Territorial Highway, where these projects have been called out, in our current strategic plan and in prior strategic plans to really identify what are we going to be working on long term. And that's been a way to really, put it out there so that staff know what the direction is, and we can just chip away at time when we have those resources or when we do have grant efforts to really see a project towards completion. Some of these do really take several years, and it's been great to see them in multiple strategic plans over the years. And I also, in the board memo on page 5, I tried to break down, some of the grant-ready projects that we thought we might spell out and really tie it to the strategic plan. So while I did mention Territorial Highway, I'm tying it to, strategic plan item 3A2, where it's, our robust infrastructure is our priority. And then under that, we have a key strategic initiative called out to really improve transportation efficiencies. That's just one example of those grant-ready projects where it's tying into the strategic plan. We have 100 River Avenue, as mentioned, Goshen, rural broadband, business grant and loan programs, and rental assistance programs. And you can see where those are all tying into the current strategic plan that we have recently adopted. And with that, I will just close by saying there's a lot of resources where we could go in a number of directions, but Austin will touch a little bit more after this in terms of what we're looking at going forward. But we just all feel like the strategic plan kind of provides that necessary cohesion, if you will, to really pull in the resources, our focus efforts. It also pulls in, some of our capital improvement plan projects to really make sure that we're all going in one focused area in the future. And then I will turn it back over to Austin, final.
Thanks, Judy. So moving forward, we will continue to rely on the strategic plan as a foundation to streamline and guide our efforts towards pursuing really what are the most impactful opportunities for our organization. We will continue to be proactive about getting projects to a grant-ready status so that when an opportunity does come up, we are simply, submitting rather than being incredibly reactive and pulling things together at the last minute. There will be opportunities that we will need to be reactive to, just given the quickly changing situation. So in addition to Nevada and Linda, who have been really great resources, we will be working with other staff teams from different county programs and departments to ensure our resources are internally organized and as efficient as possible. And as Judy mentioned, to make sure we're all moving in a cohesive direction. So that wraps up our presentation, and we're happy to take any questions from the board at this point.
Okay, any questions? I'll start with a few. Oh, Commissioner Bosebush.
Thanks. Just a couple comments. I know we have to spend a lot of this money by the end of the year, so this is tough, but I am hearing from some of my friends in the construction industry that there's been a flip in the bidding environment. Not too long ago, it was hard to get people to bid projects because they were so busy, but suddenly there seems to be a dearth of construction projects being initiated right now. So anything we can do to move construction projects ahead, I think would be helpful particularly with the community benefits lens of staying local and helping some of our local folks stay employed. Secondly, hopefully we can tie some of this money to the rural broadband expansion, because I think that can be directly tied to COVID response. Without that expanded rural broadband, distance learning and telemedicine, which are two critical pieces of COVID response, and the ability to work from home and isolate from home are critical. So whatever we can do to push rural broadband in in obtaining some of that federal and state grant money and get some of those projects moved ahead, I think would be easily tied to responding to COVID.
Thank you, Commissioner Kovach. On the rural broadband front, just as an update, the state recently put out $10 million, and we completely acknowledge the connection to recovering from a pandemic into rural broadband. It's rural broadband, something the county's been working on for some time, and with Chair Buck's help, we really catalyzed those efforts recently. And it was exciting to see that we were able to work with several communities and providers to submit multiple projects to that grant program to cover Darina, London, Lorraine, Culp Creek, Gimble Hill, Peaceful Valley, Florence, and Cheshire. So truly, we're really excited to hear the results of that and hopefully bring some dollars to our region. Wayne County and LCOG are also working with a multi-county consortium to pursue grant funds for fiber feasibility studies throughout rural Lane County communities. So I appreciate your comments, and we're doing our best to tie that into the resources and recovery efforts.
Commissioner Burney and then Commissioner Farr.
I know I'm going to be in the minority here, and I want to preface by saying that everyone from Steve and Greg and Austin and so many other people, Judy, you have my utmost respect. So with that as a preface, if I hear the word strategic plan, that was said 21 times. I think it's a plan. And I think that to be limited by a plan, when that plan did not factor in that right now we would be in a pandemic, right now we would not be in an economic depression, right now we would not have the kind of social unrest that we are having, is limiting, number one. Number two, most businesses I know, when an environment changes, pivot. And pivoting means you're moving away from everything that has been comfortably gone through a process, and this is our plan. I think it does provide a lens to evaluate priorities when resources are scarce, which they always are. Having said that, here are a few other comments. As it related to the chart that you showed us, Alex, I'm sure there are reasons, but my strong feeling is that as it related to the coronavirus relief fund, how could the state take more than 20%, and why would it not allocate the rest of the $1.3 billion to counties and municipalities to do with as they deem most appropriate? Number one. Number two, I heard a lot of reasons why we can't do things. It reminded me of my business days. I don't want to know why we can't. I want to know how we can. I believe that there are opportunities where partner groups will provide the grant writers we don't have. So if we're constantly assessing, and I'm presuming, Austin, that when you said we have to look at the ROI, I'm presuming you were applying a concept that usually deals with dollar investments and what will that return be to sort of the government approach of how much will it cost us to put in an application and how much money in staff time and how much money will we get back. If that's the case, please remember we can be entrepreneurial. There are private businesses as well as other groups that can do the grant writing for us, and we can be a partner. Oftentimes they can, and then you can decide who is going to be the recipient based on the criteria of the grant, number one. Number two, I guarantee you that all of these grants that say the money has to be spent by the end of the year, as we get towards the end of the year, and those that have been most aggressive in procuring dollars for their communities, and they have not all been spent, here's the usual ritual. Okay, well, if it's not spent by the end of the year, it has to be committed. Or, okay, if it's not committed, if it has to be spent, it has to be spent with your partner groups, and you can spend it even though the work hasn't been done yet. There are so many ways to skin a cat. I would hate that to be a reason, especially, just as an example, Commissioner Bozovich has mentioned about construction projects. You can commit dollars, even though there's going to be continuing work. We've seen that time and time again. I would hope that a bureaucracy doesn't say liability concerns are going to preclude us from getting money. Again, if we can get the money, whatever it's for, we can then negotiate those liability concerns. And if they're not negotiated to our satisfaction, we won't take the money. So these are just a few of my points. Now, I did notice on pages 4 and 5, I think, some of the stuff related to the Goshen, the Short Mountain Water and Sewer and Goshen wastewater project. So is there a specific question? Now, pontification is over. Specific question. Can we get these dollars to accelerate getting water and sewer to Short Mountain, stubbing out to Goshen? And if we can, have we talked to bulk handling? Because they've made verbal commitments to Dan Hurley and myself. They're very interested in that. And that would make our ability to procure those resources, I think, even more attractive to the giving agency. So is there a way to do that within this world of a resource?
Why don't I take that, Austin?
Okay.
Alex Kyler here, Chair Buck and Commissioner Burney. With respect to your last question, in your packet, I also did talk about the surface transportation bill that was just voted on the House the other day. It's a pretty large bill, close to $1 trillion, sort of being couched by the House Democratic caucus as an infrastructure package. I think to pretty much gain curry with the administration to try to get behind it, but that would provide some resources if it can get through the Senate in good shape for the Goshen project. All the other dollars that we've looked at that have come out of the four separate the four separate federal acts, including the CARES Act, which is the big one. I just don't see how you could fit the Goshen wastewater project into any of those funding sources. So I really appreciate your pontifications on the flexibility and the negotiability of these kinds of things, but I don't see it, unfortunately. As I indicated, we've had some concerns about how the state has formulated these contracts with gaining access to coronavirus relief funding. County Council Association of Oregon generated a very pointed letter to the Department of Justice about their concerns, and we got not a whole lot of love in that conversation. We don't believe there's going to be any way to get around the 12/30 deadline and until a few days ago, it really was, you had to have those dollars spent by 12/30. There was no obligated, nothing like that. We're seeing a little bit of loosening on that, but I'm sorry, but I just don't see that Lane County alone has the power to change the way these dollars are going to be used. It has to be, as Austin had indicated, prevention, treatment, or response to COVID-19.
And Chair Buck, this is County Council Deagle. I can respond to one of Commissioner Burney's questions if you'd like.
Okay.
Commissioner Burney asked about the release of these funds. That was, and Alex mentioned the phone call that we had on Monday. Basically what the state is doing, that was the proposal by the County Councils Association, was that we'd be more than happy, we've accepted responsibility, we had to sign, or Mr. Mccroskey had to sign, and I had to sign an agreement that we would spend the money consistent with the CARES Act. One of the proposals, the concern we had, is that the state is taking the position that they are ultimately responsible for seeing that the money is correctly spent. The specific proposal that we made on Monday was exactly what you're talking about, which is release the funds, distribute them according to the population between cities and counties. They would essentially take the money, would then pass through to the county. The county would then make a decision about how it's spent, and we would execute an agreement with the state that would say that we are accepting full responsibility and would indemnify the state if there was any claim brought that a particular county or city did not spend the money appropriately. That was flatly rejected. Their position is that the only way that can change, and Alex alluded to this, they believe that they are, because they were the initial recipient of the funds, that they are ultimately responsible to see that they're spent according to the CARES Act, consistent with it, and that their hands are tied by the legislature because the E-Board agreed or directed that the funds that come out of this be distributed on a reimbursement basis. Now, what the county councils were proposing was that money would all be released. Again, the counties would be responsible for spending it appropriately and would also be responsible for returning, if you will, if it turned out at the end of the thing, that whatever process the federal government set up in Treasury for returning any funds that were unspent by December 30th. And as has been mentioned, there's been a lot of angst on the part of county councils about sort of the onerous conditions that the state has placed on receiving this money. For example, the indemnification clause is so broad that even if a state employee were to misspend the money or embezzle it, the counties would be responsible for reimbursing the state for those funds, even though they never received them. The end of our phone call on Friday was that the lawyer for DOJ had indicated that he would be sending out to county councils a red line version to address some of the concerns that had been raised about the agreement that the state is requiring. At least as of this moment, we have not seen that red line version. So my recommendation is, as long as the board is aware that there's a lot of potential liability, essentially the way it is now and the way the state made it very clear is if you want the money, then you're going to have to sign the agreement. If you don't sign the agreement, you won't get the funds. And that's where we're at this moment.
Thank you, Chair. That sure clarifies a lot for me.
Okay, Commissioner Farr.
Thank you, Chair Buck, and thank you, Commissioner Burney, for the details that you provided or encouraged staff to provide. Ms. Mccroskey, I'm going to look directly at you for my couple of remarks because you're closest to me on my screen, but really these are pertaining to conversations that you and I have had quite a bit. You know, we have had a remarkable ability to take advantage of what is a very unfortunate worldwide pandemic. Unfortunate is not even the right word. And one of the flagships of that is 100 River Avenue. We've had an opportunity to acquire a property that will generationally serve the people of Lane County. That is just a single example that Austin and Alex and others are pointing out to us right now of opportunities that we have to put into place what ultimately will be permanent infrastructure to address the current emergency that will translate into sustained and ongoing use. And the discussion that we're having today surrounding that is really enlightening us as to how we can actually do it. Now, what really makes it possible, Ms. Mccroskey, is our strategic plan. Now, Joe, I'm looking at you on this one. You mentioned the hackneyed nature of strategic plan. Well, the term's overused. It's tried. It's become unoriginal in many people's eyes. But in fact, it's not the actual term strategic plan that is the miracle that occurs. What is embedded in the strategic plan and the way the plan is embedded in the operational function of private, nonprofit, and public organizations is what makes them resilient in the event of a global pandemic, for instance, or in the event of a national depression that caused an absolute bottoming out of housing starts back in the early 1980s. So with strategic planning, you know, back when I was a very young man, I went to work for a small hardware store that sold a little bit of lumber, a little bit of plumbing materials. And we devised a strategic plan which seemed grandiose, and it was very new at the time. The concept of strategic planning, well, it allowed us to maintain a structure while we're being punched in the face and the stomach by national chains, for instance, that entered the marketplace. And it allowed Jerry's to progress from a small hardware store, the third or fourth biggest hardware store in Eugene, to a pretty good-sized home improvement center. And it was based on an embedded strategic plan. I wish we could use a different term that would ignite people the way it really ignites me, Ms. Mccroskey, because what we have embedded and what Judy is talking about are concepts that allow us to fully move forward with what is essentially shovel ready or operational ready projects for us to grab the resources that are temporarily available to use for the long haul. And Judy pointed out 3A, number 2, improved transportation efficiencies. That's just a single item in the strategic plan that allowed us to actually move forward with some of the grant applications in a very robust and a successful fashion. So what I will say about that is that, Ms. Mccroskey, we were ready to do some of the things that Alex and Austin are talking about. And Chair Buck, you've been talking about rural access to internet since before you were elected commissioner. You and I talked about it a long time ago, because that is what you cared about. When you were working on Saginaw, for instance, you know, the people out there had such limited access to very basic necessities of life, and internet was one of them. So, and Austin, you're talking about the fact that today we may be able to increase our internet infrastructure in the county in ways that we wouldn't have been able to without having a strategic plan in place and without having the opportunity that presents itself right now. So that's really the only thing I wanted to say, Ms. Mccroskey, is being ready to apply for these grants is what is allowing us to be successful in receiving the grants that will benefit the county and the people who live in Lane County for generations beyond today. And it really is a testimonial to the fact that staff is reading from the same page, working from the same page, and operating from the same set of strategies and the same dynamic set of tactics that allow us to move forward and to pivot on our heels, if we have to pivot on our heels, while not becoming disoriented and not losing track of the direction that we are actually going as a county. So really, it's just a commentary on how well we were prepared for receiving some of the things that we are able to receive and translate into permanent infrastructure. So the last thing I'll say is, Austin, when you were talking about rural internet, you didn't mention Lowell. You hope that Lowell is included in that, because we do have at least one key employee who is suffering from the fact that it's difficult for them to work at home in Lowell because of a relatively poor internet structure. So sorry, I rambled on a little bit, Chair Buck, but once again, I am pleased that we have a structure in place that allows our staff to move forward and grab opportunities as they arise.
Okay, any other questions? All right, I have a couple comments and some questions. First comment is, part of the $10.7 million, my understanding, should be paid for by our ongoing expenses for the public health response for COVID-19. Some of it sounded like it could be available for economic development. And I think the balance that we have to create somehow is, since we don't know what kind of response we're going to need for COVID-19, we need to reserve a chunk of that, knowing that we could have a spontaneous outbreak and need to respond by hiring more tracers and other things that we need to do, versus being able to utilize it for some other economic development opportunities, and ensure that we spend it by December 31st. Because if I know the state, what we don't spend, they're going to take back and use for their own financial deficits. What I don't want is to leave 1 cent of that $10.7 million on the table. I want to be able to utilize every single thing, while we are also able to keep that balance of response funding. I feel like we need a grant writing dream team, right? We need people dedicated to writing grants for COVID-19, and we were already limited with the amount of folks that we had administratively to do that. And now many of our extra spare well, and they're not really spare, they're working on other things, are being redirected back to public health and not being able to be utilized for that particular issue. And what I don't want to see happen is we leave some kind of, like, for example, a $10 million grant on the table when if we had just paid 50 grand to hire somebody to write it, we would have gotten that 10 million. That's just a generic example, but I don't want to see that happen in Lane County. I don't want to see money on the table, but we need to have the capacity to do that too. And so how do we find the additional capacity needed to write those when we know the public health response is so high right now that they need every extra tracer it possibly can? I feel like this is our challenge through the rest of COVID-19. And I hope that we can move through that strategically with our directors and our administrator to take advantage of those opportunities out there. We do have one shining light, which is LCAW got an additional $1 million for their economic development revolving loan fund. So that was wonderful news. The questions specifically that I have are probably mainly for Alex Kyler. I believe that there is another CRF fund package that is languishing in Congress. I wanted to know exactly where you thought that was at. And I do believe that Congress is going to be out for the summer sometime soon, but I don't know when, and if we think that that might be passed prior to their summer off.
Thank you, Chair Buck, for that question. I'm in weekly contact with our federal lobby team and sometimes daily, actually, but they do believe that that package will come out by the end of July, prior to the Senate in particular taking recess. You did hear Steve Manella in the previous item speak about some language that has already made it through the House, the HEROES Act. I don't personally, I don't think, and our lobby team doesn't think that that bill will make it through the Senate, but probably some variation on it will. And unfortunately, with this increase in cases that's occurring nationally, there's probably going to be more and more inertia building for the Senate to act. And we hope to see in that is more of a reimbursement program or a revenue replacement program that assists local governments more broadly. I think the Congress really got it that the Coronavirus Relief Fund was not quite what they'd hoped by having that language about the 500,000 local government limit. So fingers crossed that we will see something coming out of Congress by the end of this month.
And what do you think that it will contain?
Well, as I said, I think it will contain revenue replacement, which was very clearly not allowed as part of the Coronavirus Relief Fund. So that if we see, in particular, like the state of Oregon, which is so dependent on an income tax, that they will have a new tool to deal with as they struggle with their budget deficit. And that will really help us because we rely on, we do rely on state funding for so many of our programs. I think it will also probably have some housing assistance money in it, as Steve Manella indicated. There was a very robust package for housing assistance in the House passed version, and I would expect that we would see some housing resources there as well. And then finally, I think we will see more. We already have seen some extensions of some of the business assistance programs that were part of the CARES Act. but that quickly exhausted the resources that were made available through the CARES Act for businesses. So I think we will continue to see more business assistance resources as well.
Thank you, Mr. Mccroskey.
Thank you, Chair, and I just wanted to add a few comments to this, and appreciate all the discussion of the board. I appreciate the discussion about the strategic plan, and I would say to Commissioner Burney's point, our intent has always been, in my time here with the county over the last 6 years, since we've had used strategic plans as a guiding force for us, we really have treated it as a living and breathing document. So you're absolutely right. It's no good if it's just sort of a point in time that that is not flexible enough to adjust to changing conditions. And we certainly have experienced decades worth of changing conditions within a short period of the last few months. And we need to adapt and adjust to that. I think we also have a culture in our organization. So planning is good. Documenting our plans and our priorities and our commitments is good. But also having a culture in the organization where we are flexible and nimble and resilient to these challenges to be able to seize the moment is as important or more important. I've oftentimes said culture eats strategy for breakfast, right? Strategy is good, but culture is much better. So we really have been working on developing that culture. I think we have made great strides in creating that sort of nimble and responsive culture in the organization. We are, and we need to continue to do that. Part of the discussion today was wanting to hear from the board about where are your priorities and where's your energy and where do you want us to focus, because we do have limited resources in terms of staffing capabilities. That doesn't mean we can't do things. It means we can only do so much. And so what I want to hear is where are your priorities and what do you want us focused on so that we can invest in those places. And that really is from my standpoint, the purpose of a strategic plan is to take what are the priorities of our governing body and then use that as a driving force for us to make decisions every day in the organization. I also appreciate, Chair, your comments about these kind of competing interests and needs. You know, we've been sort of competing a little bit back and forth about, are we focused on response or are we focused on recovery? And well, both, but it's shifted a little bit as sort of the dynamics of the virus and the emergency response efforts, you know, were under control for a bit, and now they've sort of dominated more of our efforts. So that is a competing area. I will say that I want us to be as nimble and responsive as possible. And again, I want to seek the board's feedback on that. One idea that our team has thrown out is the concept of the creation of a temporary Office of Grant Management, sort of like Office of Emergency Management, where, you know, we just say for the time being, there are resources out there that are sort of specific and targeted, and maybe we need to sort of form a more strategic and targeted group that is focused just on going after and managing grants. What we don't want to do is divert the folks that are working on the response effort, because we know that managing the virus in the community is our top priority, because we can't get to recovery and investing in all these other things we want to do if we don't actually have the public health emergency under control. So that's one thing I'd like to explore with our executive team. And we certainly can look at doing. But again, I want us to be able to find the right ways that we can focus our energy on the emergency that we need to, but also capture the opportunity to go after resources that are available. As much as possible, do both without diluting the impact or value of either of those. So I don't know if any of that I want to just say I appreciate the conversation. I want you to know that we're going to continue to look at ways in which we can make the kind of strategic investments and be flexible and nimble and go after things as we need to. But it's also important for us that we know where the priorities and energy of the board is, so that we have the flexibility to be able to go do that. We don't have to come ask you at every board meeting for permission. That to me is why the strategic plan is really important, because we can go back to it and say, oh yes, well, the board has said these are their priorities, so let's go after those areas. So any feedback you can give us on that front around your thoughts and how much energy you want us to put into grant pursuit of funding, of grant funding, in addition to the reimbursement for costs we've already spent, which is different and we're going to go after. But where is there new money that we can pursue initiatives that are priorities? I think that's really helpful.
Commissioner Burney? You're on mute.
Thank you. I'm sorry. I believe we're all on the same page, so I appreciate Mr. Mccroskey's question. I'm going to, for myself, answer it directly. One, as Commissioner Buck said, don't leave a penny on the table. Two, as Commissioner Farr said, every situation creates an opportunity that can help us in the long term, whether that's distance learning, distance medicine, acquisition of facility, etc. Three, be creative and look at how we can. I would not look at an Office of Grants management. I would look at an Office of Grants acquisition. Grants usually have the money in them to manage them. And I would be, right after I said I'm tired of hearing the word strategic, I would be strategic about it and use professionals in our community and partner with them without putting them on the payroll and decreasing our internal ROI of pursuing grants. I would be creative. I would look at how there are opportunities that would coincide with clean energy, recycling, industrial recycling, and creating more opportunity for commercial development. And finally, I would always keep an eye on something which I'm waiting for it to sink in more. I know it will, which is in our strategic plan now, which is to have a lens of good jobs, local jobs, supporting local business when there's the opportunity to support local versus going to Amazon or wherever, or using some corporate or state purchasing body. And if we have to push our goals on them. Local, local, local. Thank you very much.
Commissioner Farr.
Thank you, Chair Buck. And Commissioner Burney, something you said that I was really intrigued about, and that was outside agencies' assistance in grant writing. And I would hope that our Office of Grant Acquisition or Grant Management, whatever the term may be, looks at potentially using outside agencies, because grants can be onerous, absolutely onerous. You've mentioned, it's been mentioned that sometimes it takes years and years of administration just to account for a grant that you got in one calendar year. So all of that, anytime you can spread the load out and take it away directly from staff and equally or more efficiently, but equally effectively do it with an outside agency, it's certainly worth looking at, Commissioner Burney. Thanks for bringing that. I've never even thought about that concept. So, so thanks, Chair Buck. Thank you, and thank you, Ms. Mccroskey, for this great discussion.
Any other comments? I'll just share that I concur with Commissioner Burney about, as I mentioned, I think we needed a grant dream team, and so an Office of Emergency Grant Acquisition, or however it's stated, sounds really good to me. I'd like to pursue that. I'd like, in addition to the items that Commissioner Burney mentioned, anything related to housing assistance in that bucket would be great. That's already in our strategic plan. So I would trust the group to be able to review the document and go after the items that are on there. Any final comments on this one? Okay, I don't see any. We'll go on to number 8 on our agenda, County Council. Any announcements from you?
Thank you, Chair Buck. Just, it sounds like we've covered a lot, but I did want to piggyback on one thing that you said, which was one of the concerns that was expressed during my calls with the County Council is exactly yours, which is by not distributing the money, that it provides the opportunity for the state to hang on to any of the funds that aren't released from that. And so that was actually verbalized during that meeting. I don't have any really big announcements. I think if I understood the email from Mr. Ramirez, I think I've expressed my concerns about the agreement that the state has had. My recommendation is that we reluctantly sign that agreement to get the funds from this first group, or however you want to describe it. Again, I plan on following up with the state and asking where that amendment was in terms of the one that they suggested that they were going to send out. But just given the need for it, I understand why the board would want to proceed. I just want you to proceed in a knowing way. The only other announcement that I have is that Ms. Pavoda, my paralegal, has decided to leave and retire. And so we will be filling her position soon, but you shouldn't see a change in service from my department because we're going to be filling her duties with some 520s. That's all I have unless the board has a specific question.
Any specific questions? Okay, I don't see any. Next is executive session. We don't have any executive session today, but we do tomorrow morning. And we'll reserve other business for this afternoon. So with that, we are in recess till 1:30.